Welcome back to the Sensitivity Doctor. Today, I am taking your questions. This is another Q&A with Dr. K, and today we are exploring ADHD. How to get diagnosed. Why is it so tricky for women? Why is it everywhere? And is it connected to trauma? Okay, so many of you may know that my experience with ADHD has honestly been a lifelong journey of discovering my own traits and what it looks like in women, but also as a clinician and someone who has specialized in this area for over a decade, I am so excited that this has been a conversation that's really coming to the forefront. And I have a list of questions that I've been asked on podcasts, that I've had clients ask, that I've had ladies from my ADHD group ask, and I just want to have one place to unpack it all for you. So let's dive in. So how does someone actually go about getting diagnosed with ADHD? First of all, when you go to someone who is well-versed in this area, they're going to do a collection of things. I can tell you what I do. This may not be the same across the board, but it usually starts with a clinical interview. I do a comprehensive clinical assessment where I'm asking everything from things about anxiety, family of origin, substance use, because really, as this will keep coming up in this conversation today, is that there are so many things that can mirror or mimic ADHD symptoms. So first and foremost, that. And in that, I really want to get a full picture of how the person feels and functions overall, not just how's their attention span, but also things like mood regulation, relationships, and just different ways that it shows up in their life. The next is that you will probably do, if you're an adult, there is the adult self-report scale that I usually use with my clients. It was actually the scale that I used in my dissertation, that I used in my doctoral dissertation, where I had studied the effect of high-intensity interval training on adults, which, not shockingly, was found to help improve symptom presentation. It's super interesting if you want to go look up the whole thesis. Just kidding. But so that being said, you'll do that. It's very brief, and usually that gives a good snapshot into what's happening. Now, typically from there, if I see that the person showed symptom presentation there, and so just so we know, for kids, according to the diagnostic manual, you have to show 6 out of 9 symptoms present. And then for adults, it's only 5. Why would that be? Like, why would it be less for adults? Well, when we consider that some of the symptom presentation is, first of all, more present in children, like, for instance, one of the questions is, do you have a hard time not climbing about and, staying out of your seat and doing things in a room? Most adults have figured out how to mask this in a way that keeps them out of trouble, whether it be masking through chronic pain or masking through something like fidgeting. There's usually things that adults can kind of navigate and figure out. That's why diagnosing in adulthood can be so tricky. But that being said, in adults, it's 5 out of 9. So after that, I will normally also have my clients do the Conners, which is a little bit more thorough. It has over 60 questions. And that one, I don't have them do on their own. I personally like to do it with them so that we can talk about the answers and I can support them as they're doing the scale. Not all clinicians do that. And then some folks, and I don't have access to these or do these, will do like these games, like gamify the process where you can see how quickly people will answer questions on like speed comprehension, and there's different computerized games. Now, I will say recent research has shown that some brain scans, like the scan you might get before going and doing a neurofeedback treatment, might actually show some of the under and overactivity in the brain that is very common with ADHD, especially in the frontal lobe, which is what we know about this with ADHD, is that the frontal lobe has been shown to be some bit less developed or dense. And this can be microscopic, but it makes a difference in folks with ADHD. And in fact, further research shows that the length of time it takes for the ADHD brain to fully develop is a bit longer. So I was talking to a client recently about how she felt like her brain was fully cooked at the age of 28 versus 26, which is kind of like that typical age that we hear, when the frontal lobe is developed and we're like brain-wise an adult. But there's some science supporting that it takes a little bit longer for an ADHD brain to reach full maturation. And keeping in mind that our brains are always evolving, they're always changing, things like stress, trauma, medical diagnoses, menopause, pregnancy, all of those things play a factor in our brain. But so from that, with the diagnosis, this can be done depending on where you live. So I live in the States. For anyone here who's listening outside of the country here, licensed clinicians, licensed therapists, and social workers can diagnose. And that's why I think it's so important to make sure the person you're talking to is passionate about this area and this topic, and they've done their research and they know what to look for. Other areas I know, for instance, my students are in Canada and they don't diagnose, and it has to be through like a psychiatrist or an MD. Now, you can go to your general practitioner and they will do some of the scales, and you could technically get a diagnosis from a GP. I just find that, in my opinion, it's such a broader picture. It's not called a syndrome, but when you look at the way it's diagnosed, it's almost like a syndrome in the fact that there's no definitive, kind of like I was saying, blood test for ADHD. So I think having a broader picture is always helpful. So when we think about this, I mentioned women very quickly. I was talking about menopause, pregnancy. The second question I get asked a lot is, why is ADHD so hard to detect in women and girls? This is my passion. This is such a passion for me. And as any of you know from my book, Powered by ADHD, which is written for women, I look really closely at the intersection of societal expectations on girls and the expectation of, holding it together socially, and how that can impact the internalization of symptoms. And then we can also look at what drives girls. So research that I read in the phenomenal book, The Anxious Generation, such a good book if you haven't read it. Anyone who follows me knows I talk about this book all the time. But is that as far as like a main driver, oftentimes girls are biologically driven to community. And when we consider the fact that a lot of ADHD symptoms can sometimes not work well in a social setting, say in a classroom when it's really hard to keep your attention or hold still or keep your mind, in one direction, the pressure is so immense, especially for girls. It can become really, really difficult socially with some of those symptoms. And so the masking starts so early on, which is truly one of the reasons why anxiety is such a common symptom, especially in girls and women. The other thing too is that we need way more research. We need so much more focus on how this looks in girls and women. Because if you look at it, in fact, the first validated studies on girls and women with ADHD wasn't until the early 2000s, which is mind-blowing. So when we think about how it presents in girls and women too, we also want to look at the pressures on women. Oftentimes women are, we all know the kind of the saying of the mental load and or the expectation that women are going to plan and coordinate and scan and do and figure out and make sure everyone's okay at all times. This happens so commonly in our relationships, in our families, and even now in the workplace. So when you take the fact that ADHD brains are already constantly scanning, because that by design is what they do, and that is actually a major player in distractibility, which we'll touch on, then you compound that with the fact that there's already pressure to do that. And that is truly why anxiety is one of the major symptoms I look for when I'm working with a woman with ADHD. So how do you tell the difference? That's a question I get often asked. How do you tell the difference between anxiety symptoms and ADHD symptoms? So the big thing that I want you to all think about when you think about yourselves and you think about, is this racing thought related to ADHD or related to anxiety? With ADHD, the racing thoughts can be experienced as a restlessness or a worry that is often contributed or surrounding things around concentration, accomplishing things, making sure you are on top of things. Whereas with anxiety, there's going to be spikes around specific worries or stressors. So with anxiety, I'm looking for, as a clinician, I'm looking for something more along the lines of, do you have an extreme worry over the safety of your children? Does that impose on your ability to enjoy motherhood? Does that then maybe potentially impact your sleep? Are we seeing a trickle down effect of the racing thoughts that are related to concerns or specific worries? That to me is more in the area and arena of anxiety. Now, how do you piece that apart, however, because a lot of people experience both? Well, the reason is because according to research, if you have one DSM diagnosis, meaning depression, anxiety, PTSD, even, and ADHD, you are more likely to have more than one. And I really want people to understand this doesn't mean that there's anything necessarily more wrong with you because you have more than one diagnosis. Truly, if we really think about this, it has a lot to do with the fact that we as people are so complex. We are so layered. And to be able to really piece out some symptoms from another is almost nearly impossible at times. So just understanding that it's very common to see them together can be reassuring, that it doesn't mean something is necessarily wrong or more, quote, wrong with someone. It's just a very common co-occurrence. Another thing to consider with anxiety is really being mindful that the assessments that you're getting is looking at these nuances, and also pay close attention to how you respond to certain medications. I actually have a client who has been on anxiety medication for over a decade now. And we recently did some further investigation and discovered that she actually had ADHD. She went back to her psychiatrist, spoke to them about it, and adjusted her medication and actually went off of that and went on to an ADHD medication. She just didn't want to be on too many things at once. And please, anything I'm talking about, do with the advisement of your doctor. Obviously, we don't want to do tapering on our own. She actually found she no longer needed the anxiety medication because the ability to concentrate and not feel that constant flight of pressure and ideas allowed her to slow down the racing thoughts enough that she no longer felt anxious. And so that was a clear indicator that for her specifically, what was going on was ADHD as opposed to a more generalized anxiety. It touches my heart when I hear people say things like, well, isn't this just how all women feel? Isn't this just how all working parents feel? I mean, there's no hiding the fact that we are under so much pressure as a society right now, and society doesn't exactly help those with the ADHD symptoms thrive. Like, I really love Tom Hartman's book, A Hunter and a Farmer's World, where he explores the fact that both types of brains, the ADHD brain and the neuronormative brain, the non-ADHD brain, both serve a purpose. And when we think about the society we have right now and the pressure and the multitasking and having to be on top of everything, yet sit still, stay focused, don't move as much as you might want to. I mean, I even think about like kids who enter middle school and get, the recess taken away from them. Like, let's not stop our kids from moving their bodies. They need it. So just like our kids need it, adults need it too. And so when we consider the fact that life is not exactly set up to help ADHDers thrive, but I hope we're getting there, that is where we're going to lead into the next question I get asked often. Why are so many people being diagnosed with ADHD? And even more specifically, I had someone once ask me, well, could technology be doing this? Is the fact that we're on social media hurting us? Is this causing ADHD type symptoms? Okay, this is really tricky. Let's pay attention to what I was saying before about whether or not the lifestyle is allowing the ADHDer to thrive. So there can be people, I know people personally, I have clients who have ADHD and have managed to shape their life in a way that really works for their symptoms. Whether it be they're an avid runner, whether it be they have found the job that really matches their needs and the way their brain works, whether it be they've really attended to things like their diet, because we do see research out there showing that what we put into our body can also impact our symptom presentation, because a lot of DSM diagnoses are actually connected to metabolic rates, which is absolutely wild. But really, how can we separate the brain health with the body health? You can't. So when we consider the fact that in the right situation and the right set, you might not see symptom presentation as glaringly obvious. What I believe and what research is showing and what I'm seeing in my practice is that this adaptive brain, which really is a very unique, amazing brain when it's given the right setting and the right scenario, is not really being given lifestyles and different ways of living that are helping it excel. And so because of that, more people are noticing their symptom presentation, noticing difficulties, and asking for help. And they're also asking for help because we're finally talking about this. So do I believe that as we research this more, we're probably going to see rates increase? Absolutely. I sometimes wonder about the low rates, which generally hum between 3 to 5%, depending on what age group you're looking at. And if we saw it as a spectrum, like I believe it is, we would probably see some folks who would qualify as having ADHD, maybe a moderate presentation, versus ADHD, a more pressing or severe presentation. Now, what would a more severe presentation look like? There are things to look for with ADHD that aren't in those specific questions that they ask you for diagnosis. Little things, little unknown truths about the ADHD body and brain that not everyone knows about. One of them is it can affect rhythm. Things like dancing, music, reading out loud. These things can be a little bit more difficult when first being conquered by the ADHD brain. Now, does that mean to stop? No. Actually, it means that if we think about it, things like dancing, music, and reading can be treatments for the tempo of the ADHD body. So that's a really beautiful thing when we think about different things that help an ADHD person thrive, is that when they do these things, and maybe it feels trickier in the beginning, it actually can help them excel. Now, this is just with a caveat, folks. I want to be very clear here. I'm not saying, to quote Russell Barkley, favorite quote I've ever heard about ADHD ever, was that he said, we would never expect someone who is handicapped and uses a wheelchair, so a wheelchair-bound individual, to use a ramp enough times where they no longer need the ramp. It doesn't make sense, and it's not valid. We would never expect someone with ADHD to use a calendar enough times that suddenly their working memory is so improved that they no longer need the calendar. These are props, and these props are meant to continue supporting and helping someone with ADHD live a successful life. But what I was saying before with things like music and dance and reading out loud, things that help with tempo, these are things that may present a little bit more difficult in the beginning for someone with different types of ADHD brains, especially the inattentive, slow cognitive tempo type, which is a different area of ADHD that is under research right now. It is not part of the diagnosis as it currently is right now, 2025. But that's a distinct difference, to notice the difference between props, which are things that we need with ADHD, things like clear containers to know where things are, calendars to know when things are, visuals to give you cues, maybe even with a partner, if you feel like they're not listening to you, physical touch can be a really good prop for attending to someone and focusing. That's a prop. But the other things, the things that kind of enhance your natural abilities, those are going to be the enhancing components. So just, it's really good to distinguish the two between that. Another thing I often get asked is, do you have to take medication to manage ADHD? The absolute truth is no. But that doesn't mean it doesn't have a place. It's very important to understand what these medications are doing. Stimulatory medications are going into the brain of someone with ADHD who has an issue with delivering and receiving and processing dopamine. And standing at the front of the brain and saying, let's go. It's helping conduct the different areas of the brain so that they can turn on and off at the correct times. There's a misconception that in the ADHD brain, not enough of the brain is firing, when in fact the opposite is true. Normally with the ADHD brain, when you're trying to focus on something, especially if you don't find it rewarding, because the reward and the excitement brings the dopamine, especially if you don't find it rewarding, the increase in stimulation, which can come from the medication, or studies show even things like fidgeting, for example, can help with focus. What it does is it stands at the front of the brain and acts as a conductor to allow what areas of the brain need to fire at every given time. So that's what it's doing. That's why the stimulation actually helps with focus. And sometimes it's this kind of opposite action that can be difficult to understand. So some people really benefit from this. And whether it's because they have a more severe presentation, whether it's because they have a comorbidity that makes it more difficult to set up the life that would manage it holistically. So, for example, if you are someone who has a really deep depression or mood disorders or trauma, it can make it difficult to set your life up in such a way where you are doing all the holistic things and all the organizational things that would help manage your ADHD. So why make it more difficult? However, if you are someone who can, it is very possible. As I said, that's what I studied in my dissertation. Anecdotally, that's what I've been doing for years and years, is using specific systems, and specifically exercise, to be honest, is like, I am a momster before, and I can't handle stimulation or questions or two people talking at once. But if I go, I move my body, I stimulate myself in a really specific way, the whole brain works differently. And so that's the case for everyone. But for folks who are more dopamine deficient and or dependent on it, like an ADHD brain, it becomes the difference between functioning well or not functioning well. And so it's a really personal question. And the good thing too is there's so many options. There's the kinds you can take and see if you like, and if they don't work or you don't like how they feel, you stop, and it's not something you have to taper off of. There's others that, like Wellbutrin, for example, can help with depression and also some attention issues. There are new ones out that you can take at night that take about 9 hours to activate, so they can help you wake up in the morning. So the research continues to be really robust in looking at new medications. There is also a host of different supplements and ways that you can adjust your diet. I often recommend folks try to adjust their diet in a way that stabilizes blood sugar. And the reason being is that it makes dopamine more stable in your brain. And the stability helps with the focus, the conductor, the being able to show up for the executive functions. But understanding that that doesn't work for everyone. So it's so individual. So gosh, there are so many other questions and things that I would love to touch on with ADHD, and I might just have to come back and do a part 2. But there's one other thing I did want to touch on. It's a common question I get asked, and that's about whether trauma plays a role in ADHD. So plainly, trauma does not cause ADHD. So we need to be very clear about that. At least this is to the understanding of what the research has shown in 2025. However, many of the trauma symptoms mimic ADHD symptoms, things like hypervigilance or distractibility. So how do we piece the two apart? I oftentimes will look at the origin of the symptoms first and foremost. Were they before or after trauma? This can be especially tricky, however, if someone experienced trauma very, very young in life, maybe even pre-verbal, before they can recall whether or not they had ADHD symptoms. So I think it's important for people to recognize the epigenetic factors in this. if you are someone who already genetically is predisposed to ADHD because it is highly genetic, and you are then in a traumatized environment, because there is some connection between the presentation of ADHD symptoms and whether or not trauma occurs. The higher the symptoms of ADHD, unfortunately, research shows the higher possibility of trauma, just because of things like social challenges, impulsivity, and different factors that can act as protectors against trauma, at least the traumas that we have any say so over. Obviously, there are so many traumas out in the world that we can't control. But when we consider this intersection of the propensity of being potentially exposed to more traumas because of ADHD, that can make it look like they're linked. But another piece of this is when we look specifically at executive functioning. So you can have someone, like I've talked about earlier in this episode today, have someone with ADHD who has their life set in such a way and their coping mechanisms set in such a way where their symptoms are more managed and their executive functions are less impacted. Then you have someone who is under chronic stress or experiences trauma. So then their symptoms become less manageable and their executive functions are impacted. So again, the trauma is not causing the ADHD, but it is causing the presentation of it to become more obvious. So that is just some of what we can unpack about ADHD. This is such a complex world and there are so many aspects to it. I am more than happy to answer any questions you guys have. So please hit me up in the comments, send them to me directly at ameliakelley.com, and or check out my book if you're a woman, or even if you're not a woman, honestly. A lot of men that I've worked with, and I test drove it on my husband, the book, found it very helpful as well. So if that's something you want to check out, feel free to check the links in this episode, and be well, everyone.